Well, it's nice to see all such healthy faces looking up at me. I'll bet you anything I could find something wrong with every one of you if I looked hard enough, which in a way introduces the point about, in fact, I was going to hold up the same prop, the today's Science at New York Times, Science pages, which say, again, every dog has his data, which suggests that every one of us is an individual with different sets of issues, different needs, different problems, etc. And that, again, to quote someone here, who had quoted Margaret Thatcher, that there was no such thing as society, there are only individuals. Well, actually, society is made up of individuals, and it's the tension between the individual and the society that healthcare, in that middle, healthcare really exists in that tension. Because since Hippocrates at least, the doctor is supposed to focus on the individual patient and be the advocate for that particular patient and presumably deal with each individual's problems as if they were separate from the rest of the society, the rest of the world. However, we're going through a transformational shift. I don't want to use the cliche paradigm shift because it's insufficient to really explain the vast changes that are happening as I speak, so to speak, to healthcare. And that's because of two convergencies that had never happened before. One is that technically we now I'm speaking as a physician, we were never able to actually apply the idea of individual care to the individual patient because technologically all we had is a drug, for instance, that works in general for everybody, may not be the best for this particular individual, but it's the best we can do. It's generic kind of medicine. And so now what is happening is something called personalized medicine, which is that every patient will have sufficient information, every dog will have enough data to actually approach the ideal of having the most precise, the most individualized medical care possible. The other development that is, as we know, we're living through right now, is that for the first time, our society, our government is now confronting the issue that every person should have enough support from the society, every person should be insured to actually pay the huge costs. So these are in a way converging, making it possible to apply this idea of individualized care, but in fact, the costs are also spinning out of control, and these two things are converging, and we're living through those times. Fundamentally, at bottom, this creates an ethical or moral issue. Who gets what care? How is this going to be paid for? How is this going to be distributed? And it boils down to particular specific cases which illustrate these new ethical dilemmas. So we will also bring in the course particular cases which we will all discuss, real-life cases, to illustrate some of these ethical issues. And the most important aspect of it is that the new data about genomics, this is really what makes it so individualized. Each one of us, the expression of our individuality is in our DNA, which is different from everybody else's DNA. That's how we can identify a person. Anyway, we will be discussing how the new genomics data, which will be incorporated in everybody's record, is going to be managed in an ethical way. For instance, the data will show that your daughter isn't your own. How is that going to be relayed? Who's going to own that information? Who is going to be able to legally administer it? And who, in fact, in the end, is going to be able to produce an ethics in which this kind of framework, a kind of an ethical framework in which this kind of information can be used for the benefit of every individual, and yet without creating chaos in the society. So I look forward to seeing you in Lafayette. You already know how to get there. Yeah. So thank you very much.
Yeah, thank you, Michael.